741 here, Big 550 KTRS. Dr. Karen Boone, you've heard me talk about her for years. She's an ear, nose, and throat doctor in St. Charles. Comes from a long line of family doctors in St. Charles. Good morning, Dr. Karen Boone.
Good morning. Thanks for having me.
You got it. So we thought it'd be a good time for you to bring you in, check in with you here because you are doing, you're an ear, nose, and throat doctor. So let's just start there. Sinuses and sinus problems and sinus headaches and sinus infections used to be very painful, and to get any real relief, it was a very painful surgery, wasn't it?
It was, and people were really hesitant to even come and talk about it with me because as soon as they would start hearing that word about sinus surgery, you'd see them sort of look at you and perspiration would start because they've sort of heard all of these horror stories, if you would, about what it takes to get over that in terms of recovery, general anesthesia. It's relatively uncomfortable. And that has evolved, so I don't think that the surgery itself is that bad, but now we actually do have something that's an alternative, which is a great choice for us.
When we'll get to that in a second. A lot of people who have sinus problems, sinus headaches, sinus infections, I know my sisters have it, they just live on cold medicine a lot of the times.
They do, and over-the-counter cold medicines, can give you some temporary relief. Unfortunately, people do use them as a daily medication, which can actually lead to difficulties with hypertension, high blood pressure, coronary artery disease. And so it's not something that we as physicians would recommend as our daily choice of therapy.
Yeah. You also told me recently that some people who get colds, and they're over the cold in 2 or 3 or 4 days, but the symptoms last for weeks at a time because they have sinus problems.
Right. A cold generally doesn't go on for weeks at a time. And so if you have symptoms that begin after 3 or 4 days as a cold symptom, but then seems 4 or 5 weeks later you're having persistent symptoms, you may have developed something different.
Which is some type of sinus problem.
Exactly.
All right. So then they come along with something new called balloon sinuplasty, which sounds worse than just sinus surgery.
I did not come up with the name, I have to say. And it's been developed for a while. It has been around for a while. The idea is the same as a angioplasty. And so it was developed as an outpatient in the office procedure so that you don't have to have general anesthesia. We've been doing it for quite some time, but in the office, we've been doing it for about 2.5 years as a procedure that can be done in the office.
Right. Okay, so what does balloon sinuplasty actually do for the person who's suffering from sinuses?
If you think of your sinuses as a drainage pathway, balloon sinuplasty is to restore the natural pathway of the sinuses and how they drain so that they returned to a more normal function. The opening of the sinuses is normally relatively small and can become blocked with infection, allergy, environmental issues. Cigarette smoke is a big choice of this because it causes swelling, and so it can close your sinuses down. And the balloon sinuplasty is simply to just open that up so that it works in a more natural
Do you
fashion.
actually put a stent in there?
No, nothing remains. And that's the other beauty of it is that you do the balloon sinuplasty and the sinuses are open and then nothing is left behind. And so the recovery is very quick. And appears to be long-lasting, and that's the other really nice thing about this.
Right. So you have just been tapped to be part of some national studies?
We are. We are just developing this, and this is something that's really exciting. And so I think that it is to look at. We've been doing it for a while, and our information and the information out there in terms of reporting is that it does seem to stay for most people, and that now we're looking at longer past five years to see if that's true past then. I tell my patients that if we're looking past 5 years, that is difficult to assess on whether someone stays that long. But that's one of the things that I think we're interested in is do we get good results initially and do they stay?
So what happens if somebody's suffering from sinuses for years, weeks, months, whatever it may be, and they come in and they have this procedure? What happens? Is it all fixed? Is it all?
Well, all fixed is a big word,
right.
I guess, because it depends on what other symptoms you have. Most people that come to see me have sinus problems. They all may also have allergy issues. I always think of your sinus problem as a spoke of a wheel, and there's many things that come together with that. Sometimes we have to address other things. Sometimes that's it, and they're done, and they come back to see me when they need me.
Right. So people have gotten all sorts of relief from this balloon sinuplasty.
Absolutely. You know, as with everything in the world, it is not 100%. And I would never sit here and say it's 100%.
Right.
But for those patients, and I think that one of the things is that I'm very selective on which patients are appropriate for this procedure. Not everybody is appropriate for this. And so you have to do a clear analysis on whether somebody would benefit from this. And if we do, we are getting great results. We're getting long-term results, and people are happy because the procedure, we're very cognizant, and we try to make it an experience that is great for the patient.
How long does this surgery take?
It's about an hour.
And you're doing it in your office?
We are. We have a dedicated facility for just the balloon sinuplasty. It is been developed and designed to make the experience to be one that is a good experience for the
And you're
patient.
home the same day?
Oh, yeah, you drive home and go home. A lot of patients do have someone drive themselves,
Right.
But we've had people drive themselves to the procedure themselves.
You also said that most major insurance carriers cover this.
They do. Most of them do.
Yeah. And then Medicare as well? Medicaid?
Medicare does. Medicaid does not.
Medicare, okay. All right, good. So, and then the other thing you taught me is that you don't necessarily, you can be helped and you don't necessarily need the surgery. Right? So there are all sorts of ways to help.
Oh,
I guess.
there are all different ways to help. You know, I think that if you have the procedure and sometimes you're looking for a specific symptom relief. Sometimes someone may come to and see me and they're having sinus pressure, headaches, and snoring. I always say snoring may or may not get better with this procedure, but if snoring doesn't get better with this procedure, we can address other things.
All right. I clean my ears after every single shower, good or bad.
What do you clean them with?
And Q-tip.
Terrible.
Terrible idea.
Terrible.
How should I? What should I do? All the water gets in my ear. So I just jam the thing in there.
Exactly. And actually, we have patients that come to see us that have actually done some fairly significant injury. Put a hole in their eardrum.
Really?
Yes. So you end up removing the natural protective mechanism of the ear canal as well as impacting the cerumen. And so a better thing to do is to just clean the outside of the ear. You can use some drying ear drops, which are over the counter. But a lot of people, if the wax gets that impacted, they have to have it removed. And that can be done at a primary care physician's office, or we do that also.
So coming out of the shower, just let my ears dry naturally?
Yes.
All right. There you go, ladies and gentlemen. Dr. Karen Boone. She can fix your sinuses and make sure your ears are dry leaving the shower. Let's see. The phone number to find out more?
636-441-3100.
And metrosinus.com.
That's right.
The website too?
That's probably the best thing. We've got lots of great information. We've got some literature there. We've got some videos. I think it's pretty helpful.
And you have patients coming from all over, Southern Illinois, from Columbia, North, South, East, and West.
We do. We're very, very lucky.
Yeah, you got it. Thanks for coming in.
Thanks for having me.
You got it. 9:48. We'll come back, wrap it up. Big 550 KTRS and 11.2.
This is McGraw Live on KPLR 11.2, STLtoday.com, and the Big 550 KTRS.